just think you can wear a mask when you go out and eat. You just have to do a little bit different. So I'm just going to do a little piece of meat eating, and I'm just going to take the mask down. And then you can do it. Thanks. You just think you can wear a mask when you go out.
Good afternoon, and welcome to the first of OSHA 365 that I'm going to do over a period of 5 years. And I wanted to talk about the COVID. I got a little video that we're going to attach that shows you how to eat with a mask on in a restaurant. And I make kind of light of it because if you don't want to have any exposure, you don't go to a restaurant, especially inside. We know that outside exposure is going to be fairly minimal if you do social distancing. If you do it inside, it depends on a couple factors. We don't know what the viral load inside the restaurant is. We don't know if the ventilation in the restaurant is even adequate. But you can wear a mask, and I try to show people that you want to do as much as possible to minimize the disease. These two charts from Texas are eye-opening. First of all, the left chart in the blue is going to show that, well, look at the 20s, the highest group, then the 30s, 40s, and 50s. That's the big block of people who get COVID. Now, the unfortunate side is that doesn't reflect the deaths. The deaths are going to be horribly if you're in the 80s, but look at it from 50 on over. It's pretty even distribution on there. Even though the population is not as high and much COVID on there, the chances as you get older, once you hit 50, is pretty lethal. So I'm looking at trying to minimize all the exposures. We know that if you're low in vitamin D, we know if your low oxygen is there through like a pulse oximeter, you're not going to be in a good situation also. So we want to look at minimizing our exposure. So it's time versus the virus load versus distance, and trying to wear a mask, which will block out anywhere from 50, maybe 80% of the virus. But what we're trying to do is get the virus load down that we would inhale if we had to go inside and eat at a restaurant. I bring it up today again, nobody's wearing a mask in a restaurant. They wear a mask to the restaurant, get inside, take the mask off, then drink and eat, and they are there for hours, and that's not good. And that's why we're seeing from exposures many new cases. Thank you very much.